I'm Dr. Marissa, and today I'm going to show you 4 medical checkups that many adults over 65 agree to without asking a single question. And in some people, these tests can start a chain of events that causes more stress, more procedures, more medication, and more risk than the original problem ever would have caused. Now listen carefully. I am not telling you to avoid your doctor. I am not telling you to ignore real symptoms. And I am not telling you that medical tests are bad. But I am telling you this, after 65, every test should have a clear reason. Because sometimes the danger is not the test itself. The danger is what happens after the test finds something small, something unclear, something that may never hurt you, but now everyone feels forced to chase it. If your doctor says, let's just check everything, stay with me. If you have ever had one test turn into another test, then another appointment, then another scan, then another worry, this video is for you. Because today I'm going to give you the one question every adult over 65 should ask before agreeing to any routine checkup. If this test finds something, what will we do next? And is that next step worth it for someone my age? That question can change everything. Before we begin, type your age in the comments. And if you have ever had one medical test lead to more tests, type cascade. Because that is exactly what we are talking about today. We don't do fear here. We don't do fake promises. We connect the dots. Now let's begin. The first checkup I would never get blindly after 65 is a full body scan when I have no symptoms. I'm talking about those scan everything tests. Full body CT scans, full body imaging packages. Tests advertised like they can give you peace of mind by checking your entire body from head to toe. It sounds smart. It sounds modern. It sounds like prevention. But here is the problem. When you scan the entire body of a person over 65, you are very likely to find something. A tiny lung nodule, a small kidney cyst, a liver spot, an old spine change, a thyroid bump, a tiny shadow, and suddenly, a healthy person becomes a worried patient. Now stay with me here, because this is where the trap begins. Most of these findings are called incidental findings. That means they were found by accident. They were not causing symptoms. They may never cause harm. But once they appear on a report, they are hard to ignore. So what happens next? Another scan, then a specialist, then a biopsy, then another follow-up, then months of anxiety, and sometimes a procedure that causes a real complication while investigating something that may never have mattered. This is called the cascade effect. You walked in feeling fine, the test found something, the system responded, and now your life is full of appointments. That is why I would never get a full body scan just because I'm curious. If I have symptoms, that is different. If there's a specific reason, that is different. If my doctor is looking for a specific problem, that may be appropriate. But let's scan everything just to see is not always good medicine after 65. So your action step is simple. Before any full body scan, ask what symptom or specific risk are we investigating? And then ask if this scan finds something small, what is the next step? If the answer is unclear, pause. Do not let curiosity start a medical cascade. If this one surprised you, type scan in the comments. Now the second checkup I would never get blindly is a carotid artery ultrasound when I have no stroke symptoms. The carotid arteries are the big blood vessels in your neck that carry blood to your brain. So of course, checking them sounds logical. Who would not want to know if there's plaque there? But after 65, especially if you have no symptoms, this test can create a difficult situation because if the ultrasound finds narrowing, the next conversation may become surgery. And surgery on an artery that feeds the brain is not a small thing. Now listen carefully. If you have had symptoms like a mini stroke, sudden weakness on one side, trouble speaking, sudden vision loss, or a doctor has a specific concern, then this test may be very important. But if you have no symptoms at all, routine screening is not automatically helpful for everyone. The U.S. Preventive Services Task Force recommends against routine screening for asymptomatic carotid artery stenosis in the general adult population because the harms can outweigh the benefits for many people. And here's why. The test may find narrowing, the narrowing may lead to more testing. More testing may lead to a procedure, and that procedure carries its own risks. So the question is not just, can we find plaque? The real question is, if we find plaque, will treating it help me more than controlling blood pressure, cholesterol, diabetes, smoking, and other risk factors? That is the conversation you need, because finding something is not the same as helping someone. I once spoke with a man in his 70s who said, "Doctor, I thought more information was always better." And I told him more information is only better when it leads to a better decision. That is the key, your action step. If your doctor suggests carotid ultrasound and you have no symptoms, ask what symptoms or risk factors make this test necessary for me. Then ask, if it finds narrowing, would treatment be medication, monitoring, or surgery? Get that answer before the test. If you've ever had a neck artery scan, type carotid in the comments. Now stay with me because the third one is where many older adults become confused. The third checkup I would never get blindly is repeated bone density scanning without asking what will actually change. Now let me be clear, bone density testing can be very useful. For many women 65 and older, screening for osteoporosis is recommended. The USPSTF recommends osteoporosis screening for women 65 years or older, while evidence is insufficient to determine the balance of benefits and harms for screening in men. So this is not me saying never get a bone test, no. This is me saying do not keep repeating scans without understanding the plan. Because after a certain age, the most important question is not only what is my bone density number, the bigger question is what is my actual fracture risk and what are we doing to prevent falls? Because most hip fractures do not happen just because of a number on a scan. They happen because someone falls, they trip on a rug, they get dizzy from medication, they walk in the dark, they have weak legs, they lose balance in the bathroom. So if a bone density test leads only to a medication conversation but no one talks about fall prevention, something is missing. This is where many people over 65 need to speak up. Ask about the full picture. Your balance, your vision, your footwear, your home safety, your vitamin D level, if appropriate, your medication side effects, your leg strength, your risk of falling at night. Because preventing a fracture is not just about treating a scan, it is about protecting the person who might fall. So your action step is this: if your doctor orders a bone density scan, ask, if the result is low, what treatment would you recommend? Then ask, what are we doing to reduce my fall risk? That second question may matter just as much as the first. If you have had a bone density scan, type bone in the comments. Now the fourth checkup I would never agree to blindly is invasive heart testing after an abnormal stress test when I have no symptoms. This one is very important. A person over 65 goes for a routine check. They have no chest pain, no shortness of breath, no fainting, no pressure during walking. They feel fine. But a stress test comes back abnormal. Now the next step may be a cardiac catheterization. That is a procedure where a tube is inserted into an artery and guided toward the heart to look at the coronary arteries. This procedure can be life-saving when someone has symptoms or a heart emergency. Let me say that clearly. If you are having chest pain or signs of a heart attack, do not delay care. But in stable people with no major symptoms, the decision is more complex.
The Ishkemia trial found that among many patients with stable coronary disease and moderate or severe ischemia, an initial invasive strategy did not reduce major outcomes compared with an initial conservative strategy over the study period, although invasive care improves symptoms in people with angina. In plain English, if you have no symptoms, jumping straight from an abnormal test to an invasive procedure is not always automatically the best path. You need a conversation, not fear, not pressure, a conversation. Ask, do I have symptoms that make this procedure necessary? Ask, what happens if we treat this first with medication and lifestyle? Ask, what are my risks from the procedure? Ask, what benefit do you expect for someone like me? Because after 65, the goal is not to chase every abnormal result. The goal is to make decisions that improve your life, protect your function, and reduce real risk. A test result is not the whole patient. You are the patient.
Your symptoms matter, your kidney function matters, your bleeding risk matters, your frailty matters, your goals matter, your quality of life matters. So your action step before any invasive heart procedure, ask, is this because I have symptoms or because a test looks abnormal? That one question can slow down the cascade. If this one made you think, type heart in the comments. Now let's bring this together. There are 4 checkups I would never get blindly after 65. A full body scan when I have no symptoms, a carotid ultrasound when I have no stroke symptoms, repeated bone density testing without a clear treatment and fall prevention plan, and invasive heart testing after an abnormal stress test if I have no symptoms and no clear reason to rush. Again, I am not telling you to avoid doctors. Good preventive care saves lives. Blood pressure checks matter, diabetes screening can matter, vaccines matter, medication reviews matter, vision and hearing checks matter. Cancer screening can matter when it fits your age, risk, and health status, but after 65, the smartest patient is not the patient who says yes to every test. The smartest patient is the one who asks the right question before the test begins. And that question is, if this test finds something, what will we do next? And is that next step worth it for me? Write that down, put it in your phone, take it to your next appointment, because that one question forces the conversation that too often gets skipped. It makes the doctor explain the benefit. It makes the doctor explain the risk. It makes the doctor think about your life, not just your lab result or scan image. And it puts you back in the center of your care. Now I want you to comment one word. Which one surprised you most? Type scan, carotid, bone, or heart. And if you have ever had one test lead to many more tests, type cascade. Your story may help someone else ask better questions before they say yes. If this video helped you, subscribe, because in the next video I'll show you the common medication mistake many adults over 60 make that can quietly increase dizziness, falls, and confusion. I'm Dr. Marissa. Take good care of yourself this week. You came here thinking every routine test was automatically protective. But you are leaving knowing that after 65, the best care is not always more testing. It is the right test for the right reason at the right time. You came here with a doctor's order. You're leaving with a map.